Colorado Department of Public Health says the first round of about 46,000 vaccine doses should be arriving in our state in just over a week. And that vaccine cannot come soon enough. Today, the state's epidemiologist said they have seen around 300 cases in Colorado now of people who already had the virus and then tested positive again. And she is not sure if these people were contagious the second time around. And for the first time in a week, we added another 6,000 positive cases today. That number has been around 4,000 since last Thursday. Hospitalizations also continue to rise. There are now nearly 2,000 beds being used by COVID-19 patients. And sadly, we hit a new weekly peak for COVID-19 deaths. We ended the week of November 22nd with 247 coronavirus deaths. The last time we saw a number that high was back in April. And now more than 2,700 people have died in Colorado from this virus. Today, state health officials talked about the rise we expect to see in the next week because of Thanksgiving and also where we stand on vaccines.
Denver 7's Lance Hernandez is joining us tonight. Lance, any word yet on a specific timeline when different groups can get vaccinated here?
Not a specific timeline yet. We do know that Colorado is expected to receive its first batch of vaccine, 46,800 doses, around December 12th. We also know that like those here at Denver Health are first in line to be vaccinated.
I don't like to be a grim prognosticator here, but if the curve keeps rising, as the R value suggests it will right now, we'll see more hospitalizations, more cases, and more deaths.
Dr. John Samet of the Colorado School of Public Health showing COVID death projections now versus those with a 10% holiday-related surge and a 30% surge. The difference, 2,500 people. Those projections leading to questions about a vaccine. We asked about the time frame for immunizations. Denver Public Health and Environment says they've been told to prepare for a vaccine as soon as December 12th, but they have received no indication of allotment availability. The CDC is suggesting that healthcare workers get immunizations first, then the elderly, and later on, the general public. State health officials didn't address vaccines during their update this afternoon, but they did answer a question about immunity if you've already had the disease.
It's difficult to know if those are individuals who would have potentially been able to spread the virus or not.
State epidemiologist Rachel Hurley says there have been instances where people have tested positive twice.
Continue to do everything we can to get everybody tested.
Last month, the head of Denver Public Health and Environment tried to put minds at ease about the vaccine.
I'm confident when this rolls out that this will be effective, it'll be safe.
Dr. Anthony Fauci at the CDC did the same thing.
And I will get vaccinated when my time arrives. I promise you that.
And Dr. Hurley says we won't know about that Thanksgiving surge until about December 7th. They're going to be keeping a close watch on those statistics. She also said it's likely that Coloradans will be asked to refrain from gathering with other people from other households over the Christmas holiday. Lance Hernandez, Denver 7.
All right, Lance, thank you. And tonight we're going to go 360 on the vaccine timeline in Colorado, hearing what experts have to say. Doctors, professors, we're asking them all what a vaccine rollout will look like in Colorado. Also, if some people refuse to get the shot, what does it look like? So you can watch that tonight on Denver 7 News at 6.